upload part, like something for you to view.
Right, just sign.
Yeah,
So, let me see my grader.
It denied me. It won't let me do it without a post.
I'm on.
Some intervention listed but not related to concept. I put a concept that was like
or,
related.
so you had intervention listed, but it wasn't, or you're missing one concept or you're missing one concept. So like, here's my favorite. So a reassessment of the pain is still part of the initial intervention. Right?
Oh, I wrote this.
These people, those are my notes.
Oh.
So that's telling you what it, like, so if you reassessed for pain, that's still part of your
Oh,
first
it's
intervention.
worth like not just I.
Well, it's the monitoring.
Okay. So. This class is so like. So yes. So basically. I feel like I haven't done nothing.
Like, I don't know what the fuck I've been doing for the past 6 weeks, but it's not this.
I'm just ready to get there. So.
I don't know if I would want to give myself a license.
Let's show off this.
Yeah, but we're gonna have to wait until like tomorrow. I like to like fill it out and then make a statement. So I'm gonna now like on it. I like how you be doing your work papers. It's all that 45 questions. It's interesting. All questions. 130 questions.
What's that?
Tomorrow. I see. Did you send us this?
I didn't, because I just opened it a little bit ago, so I will though.
Oh, wait. Oh, so it's not any vote.
It's not yet. No, I'm sorry.
You're
I did see, I was going through and, yeah. But I had a lot of things I was gonna do yesterday. but then I end up forgetting I was supposed to help proctor the HESI. And then my computer was dead, so I couldn't take it in there to do extra work with me, because I was in open lab. So I wasn't charging it then, I was using it.
I was gonna say, oh, yeah.
Your code's right there. I don't know why they got everything, well, they must be using tables next door, so. All right, so we're gonna talk about evidence and healthcare quality, or evidence-based practice, right? It's we're gonna talk about how connecting evidence, how it improves healthcare quality, and how using clinical judgment makes a big difference, right? As nurses, we shouldn't be just completing tasks, right? We should be thinking about what we're doing, why we're doing what we're doing. And the reason that we do what we do is because generally evidence shows that if we continue to do specified measures, things usually get better. Okay. So where do you want to work? So we got hospital A. We do what we've always done. Tradition drives our care. Little questions of outcome. Or hospital B, we use evidence to guide care. Care is updated by evidence changes. Nurses question what doesn't make sense, or what does not make sense. Yeah. B, right? Because if we're doing what we've always done, things don't get better, right? It'd be like paper charting, which some places may still have that, or, not having an electronic health record. Things take a lot longer if they're not updating and using now the newer trends or, evidence. And the reason that they came up with like electronic health records is because it shows that the speed of services or even notifications, it happens faster. Okay. It's more secure, it's easier to read. There's a lot of things that go with it. A lot of times when we're improving outcomes, it reduces cost of care. Okay. So we're always looking for something better. All right. The thing is with evidence, it has to be proven, right? That takes time. So it is going to take a little more time sometimes to get from where we need to be, but evidence and care quality will go together because evidence supports it. The care that the patients receive are being supported and shows whether the evidence is working or not. I will send them.
Oh.
I can't do it in the middle of class though. No. When I was going through and looking at stuff, I remembered and then forgot. So, if you look at Giddens tells you, it defines evidence-based practice as facts that are either supported or disapproved by a conclusion. Okay, that matters because not everything in healthcare is automatically right. If you've ever heard, I'm sure this is just how we always have done it, right? What's the support that shows that that's good, just because you've always done it that way, right? If that's the way we've always done it and evidence supports that it's the most appropriate way to change a person, or, maybe even catheterize someone, just something, we need the evidence to support what it is that we're doing. We should also make sure that we question things that we don't know, right? We need proof. I'm going backwards. All right. So there's 3 parts in evidence-based practice. It's going to be the best research, right? using clinical expertise and patient preferences. Those are all put together in order for evidence-based practice to work. All right. What do you think are some examples of things that have changed because of evidence-based practice?
Chart.
Electronic charting. Standard protocols. So like even infection control, right? When I first started nursing, when we went into a contact isolation room, we just wore gloves, right? What does evidence show? That if we wear more PPE, then it's less likely for us to transfer any kind of infection to anybody else. So even though it's not like we're necessarily like jumping in bed with the patient or whatever, you know, even just simple things like touching them to change when we're changing the linen, right, where those bacteria are on us. Now we put on the gown so that when we take it off, it's that area has not touched us, right? We're not taking that into another person's room. How about transferring patients, right? We used to manually do it. Look at how many different machines have come out now to help with patient transfers, like Sarah Steady's, Hoyer. Well, Hoyer lifts have been around for a long, long time, but still, different smaller versions, right? So that they're more accessible for people to use. A lot of times, even thinking about backboards, right? When someone before would get injured and they'd put them on a backboard, they would stay on that backboard until everything came back. Well, they found that that's not necessarily needed as long as like they keep them straight, neck straight. They put them in a collar, right? They still will log roll and whatever, but they don't have to stay on that hard board. That hard board caused pressure injuries, you know, because sometimes it could take a couple hours, 3 hours before they can move them off. So when we look at evidence, it's that testimony of facts, right? Are the facts are either supported or disapproved in a conclusion. Everything in healthcare is not automatic. Oh my one. Oh, did I go backwards again? I did. So as a student, right, you're going to review current articles and evidence that support care with your rationales, the objective data, you follow the agency protocols, right? Think about, what do you think is the most common question or answer when a student asked why they did something at clinical?
It's the best answer.
What is the most common? Right.
Just need somebody else.
Or, right, this is what I've seen someone else do, or it's what my instructor said to do, right? But really, you should be thinking like, I did it because I don't want the patient to get a pressure, like if you're cleaning them up, right? Not just because it's a task, because you're actually thinking about the care that you're providing, knowing that if you don't turn them, if you don't change them every 2 hours, what could happen? Okay, so when we're using our knowledge, when someone says, well, why did you do that? Those should be your responses, right? Actually thinking about why you did that action, right? There's a purpose. Same with coming up with the interventions. When someone is short of breath and they're laying down and we sit them up, why? Why do we do that? Because it helps relieve some of the pressure on the lungs. You know, if they're flat, then they're laying down, it's not as easy for them to catch the breath. When they're sitting up, it's easier, right? There's not as much workload in that breathing effort. If we put them in an orthopedic position, now there's no pressure on either lung. And when they're taking their breath, there's nothing stopping that lung expansion that way. Right? So it's using those things that you know. We also want to think about things like anytime you have a skill, what's the rationale for it? So why do we check blood sugars before we give insulin? How about on teams? Why do we check blood sugars before we give insulin?
So we
So
know how
we
much to
don't
give
kill
them.
them.
So we know that that it's safe, right? We don't, if their blood sugar is low and we now medicate them with something that's going to make their blood sugar lower, we've not made sure that they're safe, but we've done harm. So when it comes to any type of medication, if it's something that could make a difference, we should always be thinking about that. What type of assessment should I do before I administer this, right? What should I be looking for before I ambulate them? Okay. Knowing just even some of those histories or what's going on. A lot of times if we even look at other data and it's wrong, it can lead to wrong decisions being made, right? I mean, I'll be like, there are sometimes I've seen nurses that will look at labs, like the patient, medicines due like insulin's due at 8 o'clock. And they know that labs were drawn at 6, right? They'll just try to go off the blood glucose from the labs. Well, that was 2 hours ago. You can't really go by that. You should be doing it now, especially when it comes to insulins and blood sugars. You're also learning as a nursing student, right, to question nursing actions. Why is that important? So you can understand why you're doing what you're doing. Exactly. Think beyond just the tasks. So, okay, when I do this, what am I expecting to happen? Right? What are my expected outcomes? Right? So that you can think about what it is that you want to occur, what you're going to look for afterwards. Connecting evidence to patient care, being able to see that, right? So when it comes to safety, when it comes to like things like evidence-based practice, that hourly rounding that they do in facilities, right? Evidence proved that the more often someone was in that room checking every hour, the patients remain safe, right? Not that things still don't happen, but there's a less likely chance. That was supported by evidence, probably many, maybe not many years, but lots of different areas that would do these studies, like skilled nursing facilities, hospitals, and then all that data gets put together and it's correlated and seeing where how it worked, what worked. Explaining why why an intervention matters, right? So knowing why it matters, right? So if we are, as far as interventions, we have our patient who's heart failure patient. One of our interventions is going to be making sure that if they're under our care, that we weigh them every day, that we are calculating or making sure that we're looking at their urine output or I&O, right? What is it what we want to see when it comes to urine output? Right. So our goal is to make sure that their kidneys are functioning. So we want to hopefully see at least 30 mLs of urine an hour. Meaning if they only go to the bathroom it's been 3 hours since they went to the bathroom and they should at least have 90 mLs of urine, right? But we do that because that helps us gauge whether they're retaining fluid, right? When someone with heart failure retains fluid, then that means their heart has to work harder, okay? Meaning that now they're stressed. If they're retaining fluid, then we know that their heart's working harder. we may end up seeing, swelling, some edema, and our goal is to help prevent that, or at least an exacerbation of it, to stop it from occurring before it does. So that's why we do it every day. That's why we teach our patients that they need to weigh themselves every day, so that we keep a closer eye on it, so we can stop it before it gets out of control. As a nurse, we're going to use the research, and also the research, the evidence, those clinical expertise, knowing patient preferences. These things are important in how we use it, because as we become a nurse, right, our accountability changes, right? We're accountable for the things that happen to our patients when they're under our care. When we're learning as a student nurse, right? Not that it's not something that you should be responsible and looking for, but it's not all based on decisions like that you have made, right? This is why you have instructors, right? Because they're the ones that are supposed to be helping you, guiding you, and to learn the things that you need to look out for and watch for. Okay. But it's not just tasks, like, and that's where a lot of problems of some nurses will just go, I have to weigh them, I have to do this, and they're not thinking about why. So if they're not thinking about why, they may just have weighed them, but they're